My name is Julie Slagle, and I am the Vice President of Patient Care Services for Sydney Regional Medical Center. I am also a registered nurse by profession, and I've been a registered nurse since 1984. When I think about this past year and everything that this past year has brought to Sydney Regional Medical Center, I can't help but think of my staff that are involved in direct patient care and what it means to be a direct patient care staff member. I remember as a nurse sitting by the bedside of so many patients that were getting ready to die or had a terminal illness. You always had the family there with you, and so you could share some very intimate moments with the family members. This past year has been extremely difficult on our healthcare staff because we weren't allowing visitors. And so staff members were not only working as the nurses, the respiratory therapist, the radiology staff, the lab staff, the rehab staff, but they were also filling the void for the family members that couldn't be with their loved ones. And I would stand back and I'd watch our staff sit at the bedside, be at the windows of the patient rooms, trying to communicate with the family that's outside of the building what's going on with their loved one. And it breaks your heart because healthcare is about caring. It's about the heart. It's about loving one another. It's about doing what's best for each other. It's about taking care of each other. And that in that we take care of family members. And with this past year and the pandemic, one of the things that we couldn't do was take care of the family members. That will be something that I will remember for the rest of my life. I'm a person that loves to talk. I love to communicate and I love to touch. That's just who I am. That's part of the nurse that I am. This last year, that was taken away. You were not allowed to touch people without having gloves on. You couldn't go anywhere in the hospital without a mask. And so the ability to smile, the ability to speak clearly, the facial expressions, those are all hampered by the masks. The ability to reach out and shake somebody's hand was gone. This last year was a struggle. It wasn't a struggle as far as taking care of our patients, but it was a struggle because, for many reasons, visitation was canceled at the hospital. And because visitation was canceled, we didn't have the family members that could come in and hold their loved one's hands or be with them at the bedside. And so our staff took on that role. They didn't only take on the role of caregiver, but now they took on the role of the family member. And although that was an absence role for them to take on, most of them did that out of the lovingness of their heart, and it became second nature to them. I remember many times that we would have somebody in the unit that was very ill, that couldn't have family with us, and our staff would stay late. They would work an extra shift just so that they could sit at the patient's bedside so the patient wasn't alone. Our staff was clothed in gowns and gloves and shoe covers and masks, and that alone provides a non-personal environment. But somehow our staff was able to provide that caring touch and that warm, loving heart that broke through any of those barriers to our patients. Another thing about this past year is it is really hard to put into words the emotions that I felt for my teammates. It was a hard year. It was a challenging year. It was a year full of changes, of uncertainty, of rules, of regulations, of things that were outside the normal for our staff. However, they pulled together and as a family continued to provide the quality care that our patients always deserve. And they took care of each other while doing that. Our staff continued to give loving care from the heart all of the time, regardless of the barriers that were put up between them and the patients. Standing on the outside looking at that group of amazing individuals providing this care, it made me so proud to be a nurse and so proud to be a member of the Sydney Regional Medical Center family. If this past year provided anything positive to the healthcare community, it promoted an uncanny ability to literally speak from the heart without saying a word to each other or a word to our patients. This team is amazing. Sydney Regional Medical Center is amazing. We are a family here, and we will continue to care for each other as a family.